So the most common condition that gets treated with shoulder replacement is osteoarthritis, just like in the hip and knee. And the interesting thing about the shoulder is, number one, like you said, a lot of people don't know that shoulder replacements even exist. So I think there are probably a lot of people out there who suffer with pain because they just haven't heard that there's an option such as shoulder replacement. The other interesting thing is that most hip and knee replacement patients, they have arthritis. Every step they take, they're in pain. They want their joint replaced now. I see lots of patients who have pretty bad arthritis in the shoulder, and they just don't think that their pain is bad enough or disabling enough to go through a shoulder replacement. But again, the most common thing that we treat is osteoarthritis. There's a procedure called a reverse total shoulder replacement that actually reverses the polarity of the shoulder, where the socket goes where the ball is and the ball goes where the socket was. And what that does is allow the shoulder to compensate for a massive rotator cuff tear. So there are people who have a secondary type of arthritis that's really from the fact that they have this large rotator cuff tear that they've likely been living with for a long time. And eventually it progresses to a point where they may have been able to compensate in the past, but now they can't really lift their arm at all. Those people, usually those rotator cuffs are irreparable because they're either so large or so retracted that they can't be mobilized back to where they're supposed to be. So the option of a reverse total shoulder replacement actually changes the mechanics of the shoulder and allows the shoulder to work in the absence of a rotator cuff.